Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then once we're finished, we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I want to acknowledge all of the healthcare workers across Alberta who are supporting our pandemic response. For 8 months, you have been on the front lines, protecting and supporting Albertans with all their health needs, running lab tests, caring for hospitalized patients, doing contact tracing, and managing outbreaks. Behind every COVID case identified and every patient cared for with any illness, there is a long list of people working very hard. The rise in cases has only increased the demands placed upon you and the pressures that you face. I know you were tired, and I hope that you are still able to find some time to recharge. I hope that you know that your work is making a difference. Thank you. Today, I will be providing an update on the spread of COVID-19 since Friday. As I mentioned last week, we underwent a system upgrade to our databases over the weekend, so we were unable to share numbers yesterday. I know that many people follow this information closely, and I appreciate your patience. Over the last 4 days, we have averaged 567 new cases per day. This is a large and troubling number, one that drives home the challenge that we are facing. Breaking it down by day, on Friday we identified 581 new cases of COVID-19, while our lab conducted more than 13,100 tests. On Saturday, we completed more than 13,000 tests and identified 525 new cases. On Sunday, we diagnosed 592 cases and almost 11,300 tests. And yesterday, the lab conducted more than 8,400 tests and identified 570 new cases. Our lab positivity rate in the province has risen to 6.8% yesterday, and in Edmonton, the positivity rate is almost 9%. In Calgary, the growth rate is still high, with an R value of 1.2 over the past 5 days. And Calgary has caught up to Edmonton, with both cities having more than 2,500 active cases each. This is not good news. This is a problem. Of all the developments that have happened since Friday, the one thing that shows some promise is that Edmonton has reached an R value of 1 over the past 5 days, showing that the measures have had some effect. It is a good start, but it is not enough yet. While COVID has consumed much of our attention in our lives, we must not forget that babies are still being born, accidents are still occurring, and Albertans continue to experience a wide range of urgent health needs. Our top priority is protecting the health system to ensure that COVID-19 does not threaten our ability to provide the essential care that Albertans require for all their health issues. Currently, there are 167 people in hospital in Alberta, including 27 in intensive care with COVID. This is a sharp and concerning increase. As you know, many non-urgent surgeries have been postponed in Edmonton zone. We are working with AHS to closely monitor the health system's capacity and, if needed, to consider steps to ensure the health system is able to support Albertans. Sadly, I must report that there have been 15 deaths from COVID since Friday. This is a heartbreaking number that underscores the seriousness of the pandemic. One of the hardest parts of my job is to report a death, any death, be it from COVID-19 or any other cause. Every death represents a person who is loved by family and friends and who will be mourned. My deepest condolences to everyone who is grieving today and to everyone who has had to deal with a loss during this challenging time. Turning to schools, as of today, AHS has confirmed that 173 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 252 schools. That is about 10% of all the schools in the province. Currently, these schools have 778 active cases in total. This number includes 117 schools that are on outbreaks, including 50 currently on the watch list. So far, in-school transmission has likely occurred in 99 schools. Of these, 56 have had only one new case occur as a result. I have said before that cases we are seeing in schools, as well as in our hospitals and continuing care facilities, are largely a reflection of the transmission that is going on in our communities. As the case numbers reported over the last few weeks show, we are facing a concerning situation, and we need to reduce the rate of transmission if we want to avoid more difficult choices in the future. It is now flu season, and I have heard some people recently dismiss COVID as no different from influenza. While there are some similarities, I want to stress the differences between them and the challenges that each of them presents to us. First, there is no vaccine for COVID-19, unlike influenza. Second, this virus is more deadly than influenza, especially seasonal influenza. While the true mortality of COVID-19 will take some time to fully understand, the preliminary data is clear. In the last 4 influenza seasons, the peak number of deaths we have recorded in a full year is 92. In just 8 months, there have been 338 deaths from COVID-19, despite taking extraordinary measures to contain transmission. COVID also has a greater impact on our health system. In the past 5 years, the maximum number of influenza outbreaks we have had in acute care in a single year was 40 acute care outbreaks in 2017-18. In 6 months alone, and despite aggressive measures to limit transmission, we have already had more than 40 COVID-19 outbreaks in acute care settings. This is not to minimize the impact of influenza or the importance of getting your flu shot, which I am strongly recommending. But it is important to highlight that we cannot treat this virus as something that our health system can easily absorb or something that will simply depart when spring arrives. COVID-19 is here, and it's not going away anytime soon. The onus is on us to adapt and to embrace the measures that will keep us safe and limit the spread while continuing to live and function as a society. For example, a large portion of the transmission we are currently seeing is within households. That means that family members are infecting one another. I have talked before about what to do if a family member is sick, but I want to stress it again now because this is an example of how simple steps can have big impacts. Many times we have seen a single family member develop symptoms and infect 5, 8, or even more than 10 others in their immediate or extended family. If you are sick with even mild symptoms, you need to take steps to protect those around you. Whenever possible, please isolate yourself in the house in a separate room from others, if possible using a different bedroom and bathroom. When you can't isolate yourself, please wear a mask and disinfect common surfaces after using them. Do not eat dinners with others in your family. Do not share utensils or food, or spend prolonged time in close contact with others, like watching a movie together on a couch. Do not go out of the house even if your symptoms are mild and even if you don't want to miss an important family gathering. That is how one case can lead to 10 or even 20. I know that there are many opinions about what this virus means, what will come next, and the best way to move forward. I continue to ask all Albertans to engage in respectful debate. COVID-19 is new, and there is no one right way to navigate this pandemic. What we do know, however, is that when COVID-19 starts to escalate, it can do so quickly and dramatically. Within the next few days, we will start to see if the recent public health measures, including the limits on social gatherings in Edmonton and Calgary, are enough to reduce the rate of transmission. If they are not, we must consider other options. We will continue to follow the evidence and to look closely at what measures may have the most impact based on the data in our province. As we watch for the impact of our changes, it is critical that all Albertans continue to follow all public health measures, regardless of where they live. In particular, in areas where case numbers are increasing, I ask you to think carefully about your actions. Avoid being in close proximity to anyone outside your household. Wear a mask when in indoor public places or in your workplace if you can't keep 2 meters of distance at all times. Consider postponing social gatherings, especially those in a home setting. If you can't postpone, consider moving them outside and keep them as small as possible. Stay home and get tested if you're sick. If you test positive, work with contact tracers to let those who may have been exposed know to stay home. These are critical steps for all of us. I know with numbers rising, there are many questions about how transmission is happening and what we have found with our outbreak investigations. We are exploring ways to have AHS share non-identifying public versions of outbreak investigations, such as the investigation into the Misericordia Community Hospital outbreak and other facilities. And I hope to have more to share soon. We are at a critical juncture in this pandemic. I know this has been a tiring year and one that's taken a mental and physical toll on many. But we cannot give up. We must not give up. I believe one of the problems underlying pandemic fatigue is a sense of powerlessness, and for some, a loss of hope. It can be easy to feel like COVID is happening to us, that it is beyond our control to make better or worse. But hope is not lost. We still have the power to collectively reverse the trend. We don't know where every exposure happens, but we do know where a lot of our cases are coming from. And that's from the times that we are interacting with our coworkers, our extended family, and our network of friends. If we all start taking extra precautions during these interactions, that will help reverse the trend and protect the health system. This month, I'm asking all of us to do everything we can to protect our family, our friends, and our community. The future is not set in stone. We are in this together, and we are powerful together. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. Could you maybe expand a bit more on the situation in hospitals right now as the numbers go up? How is it currently affecting operations in some of the province's bigger hospitals, and where do you see things going in terms of, if the cases go up and if ICU and hospital admissions go up, at what point do things really start breaking down?
So with respect, I don't have the breakdown in each specific hospital, but with respect to the cases in acute care, in Edmonton, we have 100 patients, COVID patients in hospital as of today, and the rest of the patients in acute care that I mentioned earlier, they are around the rest of the province. And so it really is Edmonton right now that is seeing the biggest impact on our acute care. As I mentioned, we have 27 cases in ICU. The majority of those, again, are in Edmonton. And really what we're seeing is the fact that no matter what age someone is, if they get COVID, a percentage of them do require hospital care. A smaller percentage of those who are younger require hospital care, a larger percentage of those who are older, but there's no age group that is spared from needing that kind of hospital treatment. We're also seeing the extra measures that hospitals need to put in place to prevent any kind of a COVID outbreak or spread in hospital. Those measures are taking extra time, extra space, extra staff. And as well, staff, of course, are living in the community and they're impacted by the spread as well. So staff members who are feeling ill, those who test positive, those who are caring for ill family members, or those who've been exposed to a case of COVID aren't able to work. And all of those factors combined are again causing these significant pressures in the Edmonton zone with the need to cancel surgeries, as we've talked about before. Thankfully, at this point, we are not yet seeing that in other parts of the province. However, I am extremely concerned about the trends in Calgary because, as I've said before, Calgary has seemed to be about 2 weeks behind Edmonton, and we do see about a 1 week lag, a 7 to 10 day lag between when we see our new case counts rise and when we see our hospitalizations start to increase. So again, there's no specific number that would tip a hospital into overcapacity. It's really about that whole system and how all the system parts are interacting with each other, and looking at when that system gets, as in Edmonton, got to 120% of their regular capacity, that they have to start shutting down the elective procedures and elective services so that they can continue to care for the urgent cases of any illness as well as COVID-19. And again, that's what we're working with AHS to watch that situation across the province. And the way to prevent those kinds of impacts on acute care is to prevent transmission of COVID-19 today.
Operator, could you put through the next question, please?
Our next question comes from David Staples of the Edmonton Journal. Your line is open.
Hi, Dr. Hinshaw. We are now piloting this project in Alberta at the Coots border crossing and the Calgary International Airport to have kind of rapid testing of people coming in. We're doing this at the same time that we're seeing this pretty massive increase in case counts, and I imagine some folks might be alarmed at any kind of seeming opening up measure at this time. What would you say to people that have those concerns, and what would you say is, what are the justifications and the reasons for this pilot project?
You know, when I said earlier that I wonder if people are losing hope, I think that part of the reason why some people are maybe feeling less motivated to follow our COVID-19 protocols is they are feeling like they can't live with the strict restrictions that have been in place for a while, for many, many months to come. And so last week, when I talked about how we have shifted the symptom list for children, I talked about the fact that we need to be looking right now at the measures that make the most sense to limit spread. And we also need to be looking at the measures that are in place that maybe aren't providing us with the greatest value, how we can start to test whether or not we can ease some of those. Because I think that Albertans need to know that we are interested in having people able to do as many activities as safely as possible, so they can have that hope that we are going to be able to live with this. And the border pilot is one example of that. We right now see only about 3% of all of our cases coming in from outside the country. And depending on what country people are coming from, many countries have actually less transmission than Alberta is having right now. And so we're needing to balance, again, these risks and saying that if somebody comes from outside the country, they may or may not have been exposed to COVID. We can do that test at the border. And then the other point to note is that if that first test is negative, they don't have to do the same kind of quarantine as we typically had people doing. However, there are a list of public health measures that they must follow in order to make sure that as we test this protocol, we're not putting our most vulnerable populations at risk. So individuals who participate in the pilot are not able to work, visit, or volunteer in healthcare settings or continuing care. In schools, daycares, and post-secondary institutions, students, staff, and teachers are not able to return to those settings until their second negative test, which is at day 6 or 7. And there's a list of other protocol preventive measures that are in place as well. So again, what we want to do is gather evidence for how we can help Albertans safely live with COVID-19 without putting undue restrictions, but at the same time protecting the safety of the population.
Operator, could you put through the next question, please?
Our next question comes from Michael King of Global News. Your line is open.
Hi there, Dr. Hinshaw. We continue to hear different reasons why the federal app can't be greenlit here in Alberta. We've even heard the Premier point to your counterpart out in BC as to having concerns with the federal app. Is the Alberta app having any impact on helping contact tracers right now? And how strongly have you pushed the Premier to adopt the federal app?
What I said last week remains true, which is that any technology that we consider using in our COVID response will have pros and cons. We know that the federal app is an exposure notification app that, unfortunately, because of the way that it's configured and the way that it works, can over-notify and actually give people an alert when perhaps they have never been in contact with someone who was infectious. And it is not connected in with the contact tracing system. And the Alberta app is another technology option which is available right now to Albertans. It is connected into our contact tracing system, and either of those apps, whether it's the federal app or the provincial app, the way that it will have the most impact is when we have as many people as possible who are choosing to use that app. It is voluntary. Again, both of those apps are voluntary. And so again, it's not a question of either or, neither of them are perfect. However, we need to pick, when we're looking at our technology options, we need to pick the one that we think will offer the most value. And I also want to emphasize that an app by itself, whichever app is chosen, is not going to save us from COVID-19. The measures that we have talked about, the basic fundamental public health measures, continue to be the most important foundation of our response. And any app that's added on top of that will simply be, again, one additional layer, but will not replace all of those other basic things that we're asking Albertans to do every day.
Operator, could you put through the next question, please?
The next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. 44% of active cases right now come from an unknown source. If we don't know where nearly half of active cases are coming from, how can we say with confidence which sectors are or are not contributing to infections? And also, you talked about household transmission earlier. So household members of a person who has tested for COVID-19 don't currently need to isolate while that person waits for their test result. Considering how high case numbers have been in the province, would this not be a preventative measure to curb the spread of the virus, and do changes need to be made to those who need to self-isolate?
It's really important when we're looking at, again, our self-isolation protocols that we're making sure that we restrict people's movements when it's necessary to do so. And of course, our increasing positivity rate is concerning. However, the thing that we have done to make sure that we are getting information to people as quickly as possible is that we are reducing our testing turnaround times. And so over the past week and a half, we have been able to make significant improvements in those testing turnaround times. And so somebody who has symptoms across the province, based on information that we've received lately from AHS, should be able to get a swab within 24 hours of them going online to book that appointment. And then many more people than previous will be getting the results of their test within 24 hours of when that swab was taken, and the majority will get it within 2 days. So whether or not, again, that question of whether people who are close contacts of someone who has symptoms need to be in isolation, again, we are reminding Albertans that when someone does have symptoms, they should be already in isolation from the rest of their family. We are doing that rapid testing approach so that we know if they have COVID as quickly as possible, so those extra measures can be put in place. With respect to the 40% where we don't know the source, that is absolutely concerning. And one of the things that is obviously driving some of the case numbers up. However, the important thing in terms of the actions that we take is that we're looking at what we do know. And what we know in the data we have is very consistent with what we know from many other jurisdictions about what the risks are. We know that risks of COVID spread are significant in social gatherings. We know that risks of COVID spread are significant in places where people are in close proximity with each other, whether you're engaging in activities like exercise, like singing, if they're cheering, laughing, talking loudly, those are the things that have the biggest impact. So what we're saying in terms of the restrictions we put in place, we're targeting where our data tells us we have problems, but also where the evidence across jurisdictions tells us where the greatest risks of spread are. And again, I think that if Albertans are following the public health measures that are in place, if they're following those additional restrictions and being cautious, that we can get our numbers down.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
The next question comes from Shannon Scott of CBC. Your line is open.
Oh, hi, Dr. Hinshaw. I'm just wondering, the Premier often quotes you when he talks about how we can't enforce our way out of this pandemic. As our cases continue to rise, do you still think that's the case?
I think that it is important to look at the most egregious cases, so where individuals or organizations are deliberately flaunting the guidance. So if there is a business that has not put in place the guidance that is, again, egregiously violating what the COVID restrictions are, then of course there should be consequences for those businesses and individuals that are choosing to put people around them at risk, for businesses that serve the public that are choosing to put their patrons and staff at risk. However, the important thing, again, is that we need to make sure that the measures that we have in place are measures that are targeted to where the highest risk is, and measures that are the least likely to have other health impacts on the other parts of Albertans' lives. And the point that I was making when I said we can't enforce our way out of this is not that we should never, again, put consequences in place for those who are deliberately violating the measures, but rather that we need to make sure that we are working with Albertans to keep our measures reasonable, to keep our measures balanced, to keep our measures targeted where they matter the most, because that's the contract that we have with Albertans, is to look at their overall health, the overall well-being of society, and to make sure that we're working in partnership with Albertans and not in opposition to them.
Operator, could you put through the next question, please?
Our next question comes from Janet French of CPC. Your line is open.
Hi there. I'm hoping you can give me some perspective on how close we are to potential further restrictions on healthcare services in Edmonton hospitals specifically. Have we come anywhere close to this 5% hospitalization increase over the past 2 weeks? Are we anywhere close to any of the sites to half of dedicated ICU beds being filled in?
So the metrics with respect to the 5% and the half of ICU beds, we certainly in Edmonton have seen an increase in ICU beds. I believe we're at 13 in Edmonton today. And as I mentioned, we have 100 individuals in hospital in Edmonton zone with COVID. What we've seen and what I mentioned last week on Monday is that the metrics that we set out are important, but they don't tell the whole story. And so we have to look not just at the 5% increase and that 50% of ICU, but we have to look again at the health system capacity. And so when we hit the 120% capacity about 10 days ago, almost 2 weeks ago, in Edmonton zone, that really indicates, again, that at the time, the voluntary measures we'd put in place before that needed to be strengthened, which is why we moved to the additional mandatory measure that was put in place last Monday. So the metrics at a provincial level of the 50% of our 70 ICU beds and that 5% increase over 2 weeks, we have not hit those at a provincial level, but what we know right now is that we can't just use those. We have to use, again, the real life situation, having exceeded that 120%, and looking at the combination of our new daily case counts to show us what the future will bring if we don't take action, which is, again, why we implemented the measures we did in Calgary.
Operator, could you put through our final question, please?
Our final question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. Calgary's mayor expressed today that we're on track as a province to hit 1,000 cases per day as soon as the end of this week. Do you share that prediction? And are you and your team trying anything new to reach people that aren't listening to your health guidance?
The predictions that are being looked at, I think, we're looking at the trends that we had in our new case numbers late last week. What we saw over the weekend were very concerning high numbers, and at the same time, they were concerning. They also were plateauing. This is not enough. People should not let their guard down. They should not back off from following the new restrictions because it's not enough to plateau. What we need is to bring those numbers down. And what we do today will predict our case numbers that we see in a week to 10 days from now. What we're seeing today, again, is due to the behaviors of people in the last week to 10 days. So I believe, based on the numbers over the weekend, that we are seeing the early part of the restrictions we put in place having some effect. As I said, This is not sufficient. We cannot stop. We have to continue to press those numbers down. We need to limit the number of interactions we're having, close contacts with people, the number of connections between networks. And that is the way that we will make sure that our future is not that prediction. And again, it really is in our hands as Albertans. And there was a second question that I did not write down.
I do not believe I caught that either. I apologize, Kevin. Happy to follow up after and address that for you.
Oh, do you?
Excellent. Kevin, are you still there?
Can you hear me?
Yep.
Okay, so my second question was just, are you and your team trying anything new to reach the people that aren't listening to your health guidance and haven't been listening over the last 8 months?
Thank you. Sorry about that. So yes, we are working on different kinds of communications campaigns that we're looking at options for how we could reach Albertans in a different way. In addition, I have been working with our communications team and different ministries to reach out to different stakeholder groups to help carry the message, not just government carrying the message, but asking partners to carry that message to the places that they have influence. So I did send a letter last week to faith leaders across the province asking our faith leaders to help in their communities, both their faith communities and broader communities, as leaders in reminding people why we need to care about each other. I had a meeting with business leaders last week. This week I'm meeting with post-secondary student representatives and working to have as many connections with people who can help us carry that message. Because again, it's not going to be sufficient for a government to be the only entity that's carrying the message of responsibility. We need to amplify that message, and we need to ensure that as much as possible, we all are a part of this collective effort to keep our health system safe and to protect our neighbors. So those are some of the things that we're doing right now.
All right, Dr. Hinshaw will provide another update on Thursday afternoon. Have a good day, everyone.